Hey, Dr. Smith, how are you?
I'm good. I can't wait to hear about this patient you've been working up.
Yeah, so TS is our patient today, and he presented today for a repeat blood pressure check
Okay.
and needed some education on blood pressure. His last doctor's visit was a week ago, and today his blood pressure is 138/88, and the doctor wanted to place a consult for the patient to be seen by our pharmacy team today for the possible diagnosis of hypertension and initiation of drug therapy if warranted.
Okay.
He does not use any tobacco. He said that he used to smoke 1 pack per day about 10 years ago, but he quit.
Okay.
And then he uses alcohol socially 1 to 2 beers per week.
Okay.
He currently uses levothyroxine 0.25 milligrams daily. And then his last lab work showed that his potassium was at 3.6, and his calculated his ASCVD risk for 10 years, and it was at 19.8%.
Okay. What about his blood pressure readings? Tell me what those were.
It was 138/90.
Okay.
And then I rechecked it, which was 138/88.
Okay. So, do you believe that Mr. S has hypertension?
I think so, yes.
And how do you know?
Because I checked the blood pressure twice on 2 separate days.
Okay. And what do we want his goal blood pressure to be?
I believe it's less than 130/80.
Yeah, less than 130/80. And where did you get that?
I think I got it from the ACC/AHA guidelines.
Very good. You're doing great. Okay. Now, so we realize he has hypertension. We would like to treat him. What drug would you recommend to Dr. Sanders and why?
I was thinking Hyzar because
okay.
that's an ARB, and it has a diuretic, so I thought that would bring his blood pressure down to goal.
Okay. Do you believe the patient is stage 1 or stage 2?
I think he's stage 2.
Okay. Now, you told me he's on levothyroxine, I guess for hypothyroid. Does he have any other indications? I'm looking at diabetes, CKD, stroke, history of an MI, LV dysfunction, or heart failure?
I don't think he has any of that.
Okay. So why did you pick Hyzar?
I just went off the guidelines. It said that it was an appropriate choice, so I went with that. And I work at Walmart, so I was thinking, we see a lot of patients who is prescribed that medication, so thought that might be the best one for him as well.
Okay. So a lot of patients are on Hyzar. That's true. Why didn't you just pick an ACE inhibitor first, or maybe plain Cozar?
Well, I knew that thiazides were first line, so I wanted him to have that.
Now, if you look back at his chart, what you presented to me, you gave me his potassium at 3.6. You still want to stick with that?
I didn't really think to look at his potassium. I don't understand why Hyzar is a bad choice if it's in the guidelines. Should I have picked a beta blocker?